There's also something called tumor necrotic factor, which is for tumors. Expression of tumor necrotic factor was upregulated in diabetes rats, and treatment with Guggulsterone led to its significant decrease. It showed an increased expression after the treatment with Guggulsterone in adipose or fat cells. The uptake of sugar in muscle tissues, meaning to burn up the glucose so you don't have high levels of blood sugar, was improved with Guggulsterones. Incubation in the presence of Guggulsterone at 100 milligrams per liter of blood resulted in about 50% increase in blood sugar uptake in 30 minutes by itself, meaning your body will burn up the blood sugar, after which it continued further for up until 150 minutes after the test. In the presence of insulin, increasing glucose uptake was not much improved beyond the effect shown by the phytochemical alone, which could be attributed to the fact that the tissues were insulin resistant. Guggulsterones has an amazing ability to improve insulin resistance. Here is the effect of Guggulsterones on glucose uptake in the psoas muscle, which is on your hips and thighs. And you can see the numbers there. This is the disease process studies. They took sections of the pancreas, liver, fat tissue from Guggulsterone-treated rats. The Guggulsterones showed a cell protective effect from this chemical in the plant. It also showed a small reduction in the size of B cells in the pancreas in high-fat diet rats was observed, which was again normalized in rats treated with Guggulsterone. So the diabetes rats had smaller pancreatic B cells, and then they actually got larger, which means they could produce more insulin for diabetic rats with Guggulsterone. While on the treatment with Guggulsterones, there was a significant reduction in the size of fat cells. Do you want to reduce the size of your fat cells? Similarly, liver tissues from diabetic rats showed marks of severe steatosis and accumulation of lipid droplets as compared to the control animal liver. However, treatment with Guggulsterone not only reversed this deformity, but at the same time did not show any signs of toxicity. You know anybody with a fatty liver? You know anybody with a beer belly? They should be on Guggulsterone. It shrinks fat cells and liver cells. They even show you what it looks like. A and C. A is the normal rat. Look at the middle one. Those are fat cells. A is the normal rat. B is the diabetes rat. Look how much bigger the fat cells are. And then look at the Guggul lipid treatment group. F. You see it? F. So D, E, F are the fat cells. Sorry, the middle images. The fat cells of a normal liver and an animal. E is the diabetes one. Look how much bigger the fat cells are. And F, look how much they shrink. Pretty impressive. Diabetes is a chronic metabolic disorder considered to be among 5 most life-threatening diseases. The so-called Western lifestyle resulted in obesity. High blood cholesterol, high blood pressure is supposed to be the root cause for these disorders. The disease process link between obesity and type 2 diabetes lies in a multitude of factors. The connection between obesity and diabetes, which includes changes in fat cell distribution and metabolism, muscle metabolism, as well as alterations in the level of carbohydrates, fatty acids, and fat cells called adipocytes. Derived factors, which include leptin, tumor necrotic factor A, adiponecytin, and resistin. Skeletal muscle is quantitatively the most important tissue involved in dissolving and burning up blood sugar. It accounts for 80% of blood sugar disposal following glucose infusion or ingestion. When you eat sugar, your skeletal muscle is supposed to burn up 80% of the blood sugar. Guggulsterone-treated group of animals during oral glucose tolerance testing blood sugar results in rats raised the possibility that this plant might have some promising effects on one or more targets in muscle tissue. Guggulsterones had resulted in a significant improvement in glucose uptake, burning blood sugar in your skeletal muscles. High G6 pace and low hexokinase activity, please don't try to memorize that, is a characteristic feature of insulin resistance, type 2 diabetes, which results in high blood sugar. Treatment with Guggulsterones resulted in the inversion of this condition in the treated group. It lowered each of these. What is G6 pace? I just wanted y'all to know it actually has a real name, glucose 6 phosphatase. The actual researchers say this: remarkable changes were observed in the adipose tissue of Guggulsterone treated group, along with a significant improvement in the expression profile of targeted genes. How many of you have heard Oprah Winfrey talk about being fat is a genetic disease? You need Ozempic. Nope, not true. Guggulsterone can actually correct it all. A preliminary idea about the mechanism of action of Guggulsterone is that it increased the expression of GLUT4 and at the same time reduced expression of tumor necrotic factor, explains how it improves insulin resistance, which helps you burn fat. Fat cells called adipocytes from treated groups were significantly smaller than in its diabetic counterparts. Smaller adipocytes are considered as healthy ones that secrete factors like leptin and adiponectin, which improves insulin-resistant conditions. Guggulsterones helps with type 2 diabetes, people. In this context, the high-fat diet fed to the rats in our experiments also showed dramatic reduction in pancreatic islets, which improved significantly in response to Guggulsterone. Pancreatic islet cells help control diabetes and blood sugar. They shrink in a high-fat diet, these diabetes rats, but it was improved significantly when they gave them Guggulsterone. We're going to skip some of those because I want to get into more about Guggulsterone. Remember, if I skip over any of these, go to the patient resource tab at the Dr. Ardis Show and download this entire PowerPoint because all of it is there. And if you want to share this information with your endocrinologist, your weight loss specialist, you might want to, so they know how to better help assist you improve your health. Googling the Guggul for prevention of chronic diseases. Guggulsterone, Guggul resin extract, you'll see it on the right-hand side of this screen, come from this Commiphora Guggul tree I showed you earlier, and Boswellia the plant. And according to PubMed, if you Google Guggulsterones, there are 449 research studies on the tree Commiphora, 519 on Boswellia, and 207 on Guggulsterone alone, the extract of it, and then 329 on Boswellia acid and 90 on Guggul, with earliest being in 1960, describing the anti-arthritis and anti-inflammatory activity of this Guggul. You'll see Guggul's in the middle. When they looked at, these researchers looked at all research studies on PubMed.gov. They wanted to know what all ways have researchers studied Guggul extract impacting the health of all diseases. Well, just look at the list. On the left, you'll see in vitro studies. These are lab studies. They saw improvements in Alzheimer's, arthritis, cancer, intestinal disorders, inflammatory bowel disease, otitis media, hearing issues, obesity, and uveitis, iritis, eye inflammation. And then melanomas in the skin. How many of you knew that? And then in human studies and animal studies, they found arthritis improvement, cancer, diabetes, infectious diseases, inflammatory bowel disease, pancreatitis is improved with Guggul, and eye inflammation. At the bottom, you'll see in this research, they discovered Guggulsterones has liver protective effects, brain protective effects. It's anti-inflammatory. It's antioxidant like vitamin C. It's heart protective, thyroid stimulating. It lowers lipids and it lowers cholesterol and it improves kidney function and it protects the kidneys from drug damage. They found all the clinical trials above that were specifically studying its effect on arthritis, asthma, breast tumors, eczema, psoriasis, gingivitis, inflammatory bowel disease, and nodulocystic acne. In vivo studies at the top. These are in the body studies with both Commiphora and Boswellia with Guggul in it. This is what they're studying in all chronic diseases. I want to highlight these for you. We're staying high level here. We're not going to dive in yet. Promising after effects of Commiphora and Boswellia against various chronic diseases in the lab setting has led to a handful of in-the-body studies where the efficacy of Guggul was evaluated in different experiment models of diverse chronic diseases such as cancer, inflammatory, cardiovascular, metabolic disorders, arthritis, asthma, and atherosclerosis. Several studies have reported the anti-tumor efficacy of Guggul in different cancers, such as breast cancer, esophageal cancer, head cancer, neck cancer, pancreatic cancer, and prostate cancer. Whew, this stuff is amazing. I bet anybody listening to this knows anybody affected with those cancers or diseases. Guggulsterone suppressed esophageal tumor cell viability. Anybody know anybody with esophageal cancer? That has a 90% death rate. If you've ever heard of anybody with esophageal ulcers, Barrett's esophagus, or esophageal tumors, they should be on Guggulsterone extract. They should be on our CardioFlow. Treatment with Guggul lipid was shown to cause reduced growth of various tumor cells. In case of prostate cancer as well, Guggul has been found to be highly effective in human studies. Administration of Guggulsterones prevented in the body angiogenesis of prostate cancer cells, the development of new cancer cells. Apart from cancer, the efficacy of Guggul is well proven in different inflammatory diseases such as arthritis, colitis, bowel inflammation, gastritis, stomach inflammation, irritable bowel disease, pancreatitis, and iritis, inflammation of the eyes, pronounced uveitis. Treatment with Guggul decreased the thickness of your joint swelling, reduced the infiltration of leukocytes, white blood cells, into the pleura cavity of the lungs and heart. It suppressed the pro-inflammatory cytokines and increased beta-glucuronidase activity in the body. Reduces inflammation everywhere. In addition, Guggul reduced the severity of irritable bowel disease, and it tells you how with those markers. Administration of Guggulsterones resulted in the mitigation or resolution of disease damage, suppressed lipase levels, neutrophils, macrophages. These are autoimmune disease markers, everybody. And cytokine production in pancreatitis. Well, I had a grandfather that was in the hospital for 3 weeks with pancreatitis. Guggulsterones was one of the things I gave him to get him out in 24 hours of the hospital, like 15 years ago. Guggulsterones inhibited the expression of endotoxin-induced iritis, inflammation and pain of the eyes, and those markers that they look for to confirm it.